Many consortia are starting to take on the mantle of GP commissioning, but there's uncertainty as to the best way forward where medicines management is concerned. So what is the value of taking on a commissioning approach to this matter? And what does this mean to the wider healthcare agenda?
I think that medicines management needs to move on from what it's traditionally been. In the past, if you spoke to most GPs about medicines management, their hearts sank because what they think about is lots of work, lots of lists, making tiny changes, and then 6 months later you have to redo all the work because the prices have changed slightly. And GPs feel that that's not actually benefiting their patients. Moving forward, what we want to do is get away from pure cost savings on budget and move to more a quality agenda where the changes we make because of prescribing actually improve the quality of care for our patients. The downsides of not outsourcing to an external provider is that you get huge variability between practices and even within practices in terms of keenness and readiness to make changes, so that one GP may really make a lot of changes and other GPs will say they don't have the time and therefore the work doesn't get done. We've seen firsthand that by having an external provider come into practices, the changes get made rapidly and efficiently, and clearly this has huge benefits in terms of cost savings. In the rest of our work as GPs, we're very used to having a skill mix and using skills appropriately. With the speed at which new medicines are coming onto market, you need someone who has got a level of expertise in the pharmaceutical industry and who can horizon scan. This is one of the great advantages of having an external provider to do this. The other benefit that we've seen from using an external provider is the possibility of partnership working, especially with reference to the pharmaceutical industry.
We spoke to expert Shailen Rao to find out how the medicines management landscape is changing.
It's a fantastic area to be able to make some improvements fairly early on. We make a major investment in medicines, and the approach often is a very incremental approach to make improvements, but I think if you approach it with a commissioning mindset, there's a great opportunity to really reshape the way services are provided. And typically the budgets are tens of millions of pounds, and instead of thinking how we can go from spending 30 million to 29, it enables us to think of it more as an opportunity to look at how we might invest 29 million, particularly when it comes to the major cost burden around hospital admissions and outcomes. They're very well evidence-based interventions that we can make to get great returns, which is what the QIP agenda is all about at the moment. So I think an essential ingredient here is the concept of leverage, and a simple definition of that is doing ever more with ever less. And that, I think, is really what's needed in the economic climate that we're operating. So if we apply that to medicines management, you start to look at and identify areas where we can make an investment to get a much bigger return on another budget. And a great example of this is malnutrition, which has often been a maligned area where it's seen as a cost line on the drugs budget. But actually it's a well-kept secret that on NICE's website they identify it as number 3 in a league table of good things that we can do to get an economic return. And what that entails is actually treating people with malnutrition to keep them out of hospital, and the returns can be gained on a very short-term basis, which is really what we really need right now. So examples like that are plentiful, but it requires us to apply a commissioning mindset rather than a prescriber or provider mindset, and that provides a great opportunity for the future.
However commissioning GPs deal with the issue of medicines management, the outcome for patients remains the driving force behind decisions.
Patient outcome is vitally important to all practitioners, be it primary care or secondary care. I personally have been involved in delivering various different services to vital surgery. To mention one, respiratory project has been a great success. We've actually clinically assessed patients, reviewed their medication, and we've actually invited patients to the clinic to have a face-to-face assessment. Patient outcome has an important example would be a patient who couldn't even walk to his door because he was really short of breath. By changing his medication, by changing his therapy, we've actually made a huge improvement to his lifestyle, to his condition, and that's what we really thrive for, is better patient outcomes.